A pleasant day to all of you. We are here to present a research study entitled Evaluating the Effectiveness and Usability of Telehealth Applications for General Consultations under the theme of Human-Centric Technology. I am Patricia Antonette Ortiz with my co-authors Joshua Luis M. Dela Cruz, Daniella A. Ughoc, and Ms. Estefanie Bertumen of Dela University. Next slide. The past 2 years of the COVID-19 pandemic had led to limitations in how often individuals can visit the hospital. Telehealth, however, allows for patients to receive medical care without the need to go outside, and it has become a widely used tool in the pandemic to accommodate outpatients. Here, with the global advancement of communication technologies and supporting infrastructures, it is undeniable that telehealth consultations have become a more efficient healthcare delivery service, especially in developed countries. Yet, given the current healthcare situation in the country, it is more important than ever that the Philippines provide a viable method of providing medical assistance. Alice et al. In 2009 observed that archipelagic developing countries like the Philippines face difficult technology infrastructure problems. This is further backed by Anoran et al. In 2021, which stated that the lack of sufficient technology infrastructure requirements of telemedicine services such as software, hardware, and fast networks hinder and limit the utilization of telehealth, specifically service usability and work efficiency in underdeveloped and developing countries. Next slide. With the scarcity of studies conducted to establish the overall implementation of telehealth in the Philippines, this research study aims to evaluate the effectiveness and usability of telehealth applications for general consultations in Region 3, Region 4A, and National Capital Region in the Philippines. The criteria for the scope of these telehealth applications are the ones which are solely used in telehealth practices. This includes analyzing several factors such as usefulness, ease of use and learnability, interface quality, interaction quality, reliability, and satisfaction and future use, affecting the usability of the identified telehealth applications and technologies in delivering healthcare. Next slide.
The effectiveness and usability of the commonly used telehealth apps were evaluated on how it improves healthcare delivery to patients through quantitative research. 2 data collection activities were done through Google Forms to obtain the necessary data to determine the usability of telehealth applications for general consultations. First is a survey for commonly used telehealth applications, wherein various individuals were surveyed to identify the 5 most commonly used apps. After the top 5 applications were determined, the main usability survey based from Fermanto et al. 2016 Telehealth Usability Questionnaire was disseminated among National Capital Region and nearby provinces Region 3, Region 4A citizens with prior experience to telehealth general consultations. In line with this, the TOQ was anchored with other models such as the Telemedicine Satisfaction Questionnaire or the TSQ for the usability factors of usefulness, satisfaction, and interaction quality, the Technology Acceptance Model or TAM for usefulness and ease of use, and the IBM Post-Study System Usability Questionnaire or the PSSUQ for ease of use, interface quality, reliability, and satisfaction. Furthermore, a simple random sampling was used to obtain the participants for the initial survey. On the other hand, random purposive sampling method was the method of selection for the participants of the main survey, as there was a specific characteristic, which is the telehealth application used to represent the population. Next slide.
Moving on to our results, starting with the initial survey. This table showed that 207 individuals answered the survey of commonly used telehealth applications. Unqualified respondents such as health practitioners, patients below 18 years old, and patients that use telehealth applications that did not confine with the scope and limitation of the study were filtered out. The final sample achieved for the preliminary survey was 196, of which 49 were male and 147 were female. Different age groups were also recorded with 172 respondents between ages 18 to 24, followed by 12 between 25 to 34, 7 were aged 35 to 44. 4 of the respondents were part of the 45 to 54 age group, and 1 belonged to the 55 and above age group. In terms of the location, the majority of the respondents reside in Region 3 with 161 residents, followed by NCR at 17, 15 came from Region 4A, and Region 1, Region 2, and Region 7 have 1 respondents each. Next slide. From the analysis of the data collected from the survey of commonly used telehealth applications, We have identified the top 5 most used telehealth applications. This table showed that 21 of the respondents used KonsultaMD as one of their telehealth applications. The second most used application by the respondents was Now Serving, which garnered 12 users, followed by Medifee with 11 users, Easy Consult with 10 users, and Dokata with 10 users. Other telehealth applications used by the respondents were WebMD with 1 user, MD Live with 1 user, and Aid with 1 user. Next slide. Meanwhile, this table shows the remaining respondents who used other telehealth applications that were not in line with the study's definition of telehealth. Such applications were Facebook with 18 users, Zoom with 3 users, Viber with 2 users, PJG Telehealth with 1 user, Google Meet with 1 user, as well as Tau Med SS. Meanwhile, 116 respondents said that they have not used any telehealth application. Next slide. The sample achieved for the main Telehealth Usability Survey was 54 respondents. However, multiple responses from the same email account were excluded, resulting in a final sample of 51 participants. The demographic information of the respondents is presented in the table. Among the total participants, 41.18% are male and 58.82% are female. Looking at the age groups, 45.1% are aged between 18 to 24, followed by 29.41% between 25 to 34, 9.8% between 35 to 44, 7.84% between 45 to 54 years, and also 7.84% are aged 55 and above. With regards to location, 35.29% are residing in Region 3, 21.57% are in Region 4A, and 43.14% are living in the NCR. The percentage of respondents from Region 3 was significantly lower compared to the number of participants who responded in the initial survey. Next slide. According to a study of Chu et al. In 2021, gender is an important factor that needs to be analyzed since it can significantly impact the TUQ scores. To identify if gender affects the telehealth usability scores for each factor, a t-test was conducted. The mean TUQ scores for both male and female respectively are 4.03 and 4.07 for usefulness, 3.78 and 3.79 for ease of use, 3.58 and 3.69 for interface quality, 3.82 and 3.78 for interaction quality, 3.03 and 3.2 for reliability, 3.7 and 3.77 for satisfaction, and 21.94 and 22.29 for the total TUQ score. In all factors except for interaction quality, the TUQ scores among female participants are higher compared to the males. This result is consistent with other literature that claim that female doctors, nurses, and other users are more likely to use telehealth applications. From the result of the t-test, the p-values for all factors are greater than the level of significance as shown in the table, which means that the test is not statistically significant. Therefore, in this study, there is no significant difference in TUQ scores between genders. Next slide. The different telehealth applications score on the usability factors and their total TUQ scores are listed in the table. The mean total TUQ scores are 26.09 for ConsultaMD, 24.67 for Medifee, 23.71 for Now Serving, 18.85 for Easy Consult, and 17.02 on Dokata. All the applications rank consistently with ConsultaMD as the highest, followed by Now Serving, Medifee, Easy Consult, and Dokata with the lowest score in all categories. Thus, the scores of ConsultaMD will serve as the benchmark for each category.
Moving on to gap analysis, a 2017 study by Kiley et al. Affirms that the inclusion of information and content addressing the barriers to patient acceptance and adaptation of telehealth boosts the usability of an application. Herewith, in terms of usefulness, ConsultaMD proved how it enhances patient accessibility of healthcare services with its partnership with over 60 e-health and payment services. Next, the assessment of another factor involving ease of use and learnability displays that the ConsultaMD application satisfies all the criteria suggested by Hoike et al. In 2019. This can be seen by how only ConsultaMD has incorporated frequently asked questions among its menu bar, while the remaining apps have not allotted such an option. Moreover, the 2016 study of Parmanto et al. Also indicated that graphical user interface, ease of navigation, and an overall impression of patient interaction with the telehealth application affect the interface quality. KonsultaMD, Medify, and Now Serving readily shows graphics and pictures that aid the users in navigation. However, KonsultaMD is the only one with a text-based side menu bar compared to others which have it on the bottom of the page. Next slide. In addition, audio and video quality and the similarity of telehealth consultations with in-person ones affect the interaction quality. According to a provincial health office in 2020, in-person visits usually allow patients to be examined by a resident on duty for general consultations, and a follow-up consultation with a consultant is scheduled for further evaluation. Coherently, KonsultaMD and Medify both have a button of consulting a doctor, separate from an option of looking for a specialist, which makes them optimal for general consultations. In contrast with Now Serving, Easy Consult, and Docoto, which only have the menu item to seek a consultant for specific fields. The reliability of the technology depends on the software's ability to avoid system issues. If an error occurs, reliability is also measured in how the user recovers from the error and how the application provides instructions to the user, which also includes simple exit confirmation buttons. KonsultaMD, Medify, and Now Serving includes instructions on how to reach customer service in case of issues. The last two apps have no contact information given. Lastly, satisfaction and future use refer to the overall satisfaction of users regarding the telehealth services provided by the application and the willingness to use it again. The service quality of the application, which, including all the previous factors, affect the user's satisfaction. As the ranking of the applications in previous factors stayed almost consistent, it is predicted that it will be similar with the results of the satisfaction factor, with KonsultaMD as the top application. Next slide.
In conclusion, this investigatory project mainly aimed to evaluate the effectiveness and usability of telehealth applications. Moreover, it provided recommendations for the improvement of the usability of each apps utilized in general consultations. KonsultaMD, Medify, Now Serving, Easy Consult, and Docoto are the top 5 most commonly used telehealth apps in Region 3, Region 4A, and National Capital Region. The study clearly exhibited that among the 5 apps in the geographic scope, KonsultaMD is the most efficient in terms of all the telehealth usability factors, including usefulness, ease of use and learnability, interface quality, interaction quality, reliability, and satisfaction in future use. Next slide. The factors regarding content quality and information accessibility affect their usefulness, information visibility, and visuals for ease of use. Graphical user interface, ease of navigation, and overall patient impression influence interface quality. Audio and video quality and similarity to in-person visits for interaction quality, quick recovery and instruction manual for reliability, and application consistency and customer service for satisfaction and future use, which were documented and revealed by the ample screen caps and related literature. Additionally, the gap analysis deduced that the use of telehealth application is an effective alternative in managing healthcare and accessing e-health services by allowing patients to experience quality consultations without the expense of traveling long distances. Furthermore, the study has provided noteworthy insights and more information regarding the comparison of the different telehealth apps, the relation between the 6 subdomains of telehealth usability, as well as its significance in academic and real-life contexts. The findings may provide sound groundwork for government agencies and non-government organizations, hospital staff and healthcare workers, and patients in planning, developing, and implementing telehealth consultation services along with its wide use in the Philippines. That ends our presentation. Thank you very much.